Nurse Maud has been around for over 120 years. It started off 1896 when Sibylla Maud, who was a matron in Christchurch Hospital at the time, decided that her real vocation was in the community, looking after mostly the poor in those days who couldn't afford hospital treatment. She started what was to be recognised later as Christchurch's first district nursing service. Now we've moved on from one person on her bike to employing around 1,500 people.
Rostering, currently we're delivering over 100,000 visits per month across 3 regions, so it's a very complex operation.
Really, we had a system that was old, was inflexible, it was becoming expensive to modify and to improve. It really had reached the end of its useful life.
We wanted a solution that would manage the allocation of staff and resources to clients and patients on a mobile platform that would gather data and information about those patients and clients that we could measure the outcomes of care we were delivering.
So we needed something that really was going to equip us for the next several decades, really. But it's the risk of doing nothing and remaining with the status quo.
Well, Nurse Maud always wanted a cloud-first approach, so we suggested Microsoft Dynamics 365, supplemented by field service and resource scheduling optimization. We also wanted to incorporate mobility, so we used Resco for that, and we also wanted to incorporate all of their existing legacy systems, which were valued, and incorporate that so it could be used by the solution as a whole.
Microsoft and Intergen were our choice in the end. We believe that each of them in their own way met our requirements for the future.
Transformation requires complex integration. An example of that has been the integration with Pay Global system. Has meant that we have moved away from paper-based timesheets for a significant portion of our workforce to them being able to complete all of their timesheet requirements on their phones, and we get accurate visit data and we're able to accurately pay our staff, which has been a significant improvement and business benefit.
For me, from a clinical point of view, it was about being able to share information. And in order to have a good crossover between different services as well, being able to see what each other had written about a client, being able to see their previous progress notes, for example, was a really important part of what we were doing for me.
They have all the information they need for the client before they visit the property. They can know whether there are any alerts for the property. It's the cornerstone of the whole platform for us, really.
Certainly clients are no longer having to tell and retell their story. I think there's an expectation these days that they don't have to keep telling the same thing over and over again to a different person if it's a different worker that comes through their door.
We also need to have the ability to communicate with other healthcare providers, so this is providing us a platform from which we can build and begin to develop those collaborations.
Another important part about this system is that in the mobile view, mobile CRM is visible both online and offline. The support workers only see who they need to see at that time. The digital solution allows us to match competencies and skills of the support worker to the needs of the client.
Ultimately, the technology for Nurse Maud is an enabler, because the important thing for us is getting the right people, the right qualifications connected to the people that we serve in an efficient way at the right time.
Now this foundation is in place, there's actually sort of out-of-the-box support for IoT. It uses AI to actually create insights on that data that can actually be beneficial to the patient.
At Nurse Maud, I think we're very excited that we've positioned ourselves well for the future.